Breaking news, everybody. There's a pandemic going around our country called COVID-19, and it's taking lives everywhere. COVID-19 is spread from person to person. You can become infected from a respiratory droplet when an infected person ends up coughing or sneezing or doing something like that around you. So your best bet is to try and protect yourself by wearing a mask. And the mask should not just be worn covering just your mouth. You make sure it covers your nose and your mouth so that any breathing airways are protected from getting any of these coughing or sneezing droplets into your respiratory system. Having a mask on prevents droplets from getting in, prevents any sicknesses from latching on, prevents anything that is trying to harm your body through the respiratory system from attacking you head on and so strong. So try to protect yourself as much as possible by wearing one of these masks. Please make sure you wash your hands. Washing your hands is very important. You have to make sure you get all of the germs that are on all of these surfaces off of your hands. When you wash your hands, make sure you wash them for at least 20 seconds. And you need to use like an alcohol-based hand sanitizer, something with at least 60% alcohol in it, so that you can make sure that your hands are basically being like sterilized. If you decide to touch like a table or a dresser or maybe just like an office desk or something simple, or going into the store, whenever you touch something, you want to make sure that you're walking around with some hand sanitizer to clean your hands back off, or finding your way to a bathroom to wash your hands right away. Because the one thing you never want to happen is for you to actually be in a store and you pick up a piece of food and you put it in your mouth, and now you have just contracted the disease. You don't want that to happen. So please be careful. Wash your hands. Try not to touch surfaces maybe without gloves. And if you do touch surfaces without gloves, always have hand sanitizer. And like I said, make sure it's at least 60% alcohol. Social distance. Please keep your social distance from other people, at least 6 feet distance. Coughs and sneezes travel far. I can't say that enough. No matter what you're doing, no matter where you are, if you're standing in line, if you're walking around, if you're at work, if you're doing anything, please keep yourself protected. Stay 6 feet away from each other. Stay in line, stay 6 feet away from each other. In the grocery store, try to stay 6 feet away from other people. At work, stay at your desk, stay 6 feet away from other people. I can't reiterate it enough. People are dying out here. This disease is causing national deaths. Our individual states are noticing the numbers increasing daily. After everything that has been going on since this pandemic started, we have watched the nation suffer, the entire nation, from a disease that can't even be cured. I lost my own father to this disease, and he just died in April. You don't want that to be you or your loved ones. So protect yourself. Stay clean. Keep hand sanitizer. Wear a mask. Avoid going out in public unless you have to. Please let it be essential. Let it be something that you desperately feel like you need, or it's a necessity. Don't go out for frivolous things or trying to just hang out, party, going to clubs because they opened it back up and things like that. Try to practice willpower and stay home to protect yourselves. I don't want to die for a party. The CDC is offering free assessments online, even through Google, if you would like to go look it up online, for you to take the self-assessment at home. If you can ask yourself the questions of the symptoms that are out here, and if you are feeling them, that's when you feel as though you need to go to the hospital, and you may need to go ahead and take a COVID-19 test. Right now, if you're experiencing anything that's close to the symptoms of a fever or anything similar to the flu, I would advise you to go ahead and get checked, or try and at least take the self-assessment and cancel off how many things that you see that you are feeling, and let them evaluate you enough to let you know if you should go take a test or not. But the resources are available, and as long as they are available for you to be able to check on yourself and make sure that your health is in good shape, use it. It doesn't hurt to use it. Just takes a few minutes out of your day to go ahead and take this little assessment. It's only a couple of pages of one question per page, of just trying to assess how you're feeling and your symptoms that you may have inside your body right now that may be similar to the symptoms of COVID-19. Everyone, I am pleading with you. I don't know how much I can say this, but I am pleading with you to take care of yourselves. When you wear your mask and wash your hands and keep your distance for at least 6 feet, you can try to stay safe. People are dying from this. Please give everyone a chance. And if you're a selfish person that doesn't really care about other people, at least give yourself a chance. Thank you for your time.